DREAM stands for Diabetes Research Envisioned and Accomplished in Manitoba, and we're a translational research team that started about 10 years ago, funded by the Children's Hospital Foundation here in Winnipeg. In Manitoba, we have amongst the highest rates of youth-onset type 2 diabetes in the world. It breaks my heart to see kids and families in my clinic that are impacted. Not only themselves, but their parents, their grandparents are impacted. It's an intergenerational disease. And sometimes I feel helpless because I know a lot of the things that they face where they live, lack of access to places to play safely, to be active. They don't have access to healthy foods like my children have access to. And so I really hope to advance knowledge such that the kids that I care for in my clinic have the same access that my kids have, and they don't have the same long-term impacts from their diabetes.
The partnering with institutions in our area for the purposes of research is, I think, a critical exercise that's needed. We have 4 communities that we represent in northern Manitoba. We're approximately 600 kilometers north of Winnipeg. We're a fly-in and winter road access only. That sort of impacts the quality of health services and access to health services for our community members. And we have 1 store in each community. Shelves that are filled with chips, drinks, all of which are not very healthy for consumption, and a huge change in the diet within the community.
My son was just shy of turning 13 years old when he was diagnosed with type 2 diabetes. And it was traumatic, I'll say. So I believe it's important that the community is involved in the research because we have a personal stake in whatever research is happening, because we are either ourselves living with type 2 diabetes or we have a child or family members who are living with type 2 diabetes. So it's really important, and it provides us an opportunity to be part of the solution.
These parents have put a lot of their faith in us to do something about this intergenerational type 2 diabetes and these risks to their kids, and they've been enormously generous. We're also doing a lot of messaging with community about traditional lifestyles. So we know the impacts of colonization have impacted the health of these communities. And in order to sort of go back to some of those traditional ways of knowing and being and improving care with the kids, we spent a lot of time with community building programs, building screening in partnership, which allows them to also have some control, some autonomy over the health of their community and when we come and when we screen and how we work with our community members. And so the partnership is beautiful, and it's a really important part of the work that we do.
In children, the diabetes advances much more rapidly, including the loss of insulin-producing cells and the onset of cardiovascular and cardiorenal complications. Basic science research helps us to identify the genetic, metabolomic, and cellular mechanisms that lead to the development of diabetes, and will allow us to develop personalized treatment strategies. We use a range of approaches that includes cellular imaging, respirometry, and bioinformatic approaches. So there's a lot of cutting-edge type of technologies that we use.
The collaborations between clinical and basic scientists at DREAM really are unique in my opinion. So one of the mandates of DREAM is to really foster those collaborations. And because we all sit at the same table and we sit under the same roof multiple times a month and have these discussions, and we're all open to learning from each other, we can really, really understand not only what's happening in the clinic, but the clinicians are understanding what we're learning in our models. And the Next Generation cohort or research project is really about understanding intergenerational stress and trauma and how that influences diabetes outcomes for children in the next generation. So what we do in our lab is we use mouse and cell models to reverse engineer what we're learning from people in the next generation study. And then we try to study the mechanisms and the things that we can't really study specifically in humans.
Ever since I got diagnosed with type 2 diabetes, I've been involved and I've been part of the iCARE research. So iCARE is improving renal complications in adolescents with type 2 diabetes through research. throughout my whole journey, I've been very much supported. I know there was a lot of stigma I faced being diagnosed and going through the system like that. But I think with my diabetes, not only has that empowered me, but also my family. Like, my family definitely had more education that they were given, provided that I got diagnosed with diabetes. And diabetes running through my family, especially on my dad's side, like, they didn't know a lot of these things. And I think that really empowered not only me, but them as well.
As a team, we're really hoping to improve the wellness of children and families living with diabetes. That's really at the core of what we hope to achieve. Of course, we would like a cure. We would like to prevent complications in children living with diabetes. But I think a significant improvement would be to identify at-risk children, to be able to implement prevention strategies so that we can delay the onset of diabetes. And then once children develop diabetes, to institute therapies that are right for them that will prevent complications. Right now, we know that a child diagnosed with type 2 diabetes has a 50% chance of ending up on dialysis in their young adult life. And so my dream is that we can prevent that from happening, and that this generation of youth living with diabetes won't be affected by kidney failure.